So we're going to start off by talking about 4 most common running injuries, just to give you a little bit of a better idea of what you're facing. Okay, now obviously we're not going to be able to cover every single injury here, but we're covering some of the most common things. If you find that these are your symptoms, great. If you find that your diagnosis is a little bit different or your symptoms are a little bit different, you can always just put in the chat or the Q&A, and we can talk about that afterwards. The first thing we're going to talk about is knee tendinopathy. Okay, a knee tendinopathy it's one of the most common running injuries with the knee, and it's pain around the kneecap. So not actually on top of the kneecap, but around it. So either kind of on top of it here, or on the tendon that attaches to the top, or the tendon that attaches to the bottom. So if you take the skin away, this is what it kind of looks like. So again, it attaches to the top or attaches to the bottom. Now, this particular pain can be a little bit dull or sharp, depending on how severe it is. And this is what it looks like with running. Okay, so there might be a little bit more pain at the beginning of the run or when you're actually warming up. Sometimes there is usually more pain with foot strike. So when you're actually landing your foot rather than when you're pushing off. Typically, there's a little bit more pain going downhill rather than uphill. And then in severe cases, when there is a lot of pain, you can actually have pain at rest rather than just during your runs. And it's that type of pain which actually feels a little bit better with moving. But then when you rest for a while, say you sit down for quite a bit and then you get up, this is when you might feel a little bit more pain. So if these actually sound like your symptoms, I want you to put tendinopathy in the chat. Okay, just type in tendinopathy in the chat, everybody, if you feel like these are the symptoms you're having. I just want to see how many folks in the audience are struggling with this particular issue. So I'm going to walk you through a little bit more about what exactly happens here. Okay, so tendon itself, it can be, so tendons, again, this white part here. Okay, so it's a part of the muscle that attaches it to the bone. Now, sometimes it can be a little bit weak, and that can lead to, if you do axis running, that can lead to some inflammation, some swelling on the inside. So if you look at this diagram here, don't worry about the labels or anything, but the green part is kind of the healthy part of the tendon. The red part is the part that's got a little bit of swelling on it, okay? And if you keep running, if you don't address this, and what happens is that part actually starts breaking down a little bit. So the red part, it starts breaking down, so now you've got kind of a healthy tendon, but then inside it, you've got some swelling, you've got some problems. And then that actually leads to the rest of the tendon that starts to break down. So it sometimes can be a pretty severe problem. Now I'm gonna give you some general guidelines around what you're gonna do to manage this, but then we're gonna talk about some specifics after, okay? So things to do for this: you're gonna avoid downhill running, okay? You're gonna avoid narrow trails. And things you can do is to try more of a forefoot strike, which is to say kind of land on the front part of the foot, kind of the mid to the front part of your foot, rather than landing on your heel or landing just kind of directly in the middle, okay? And reason for that is forefoot strike, actually there's some research that shows forefoot strike reduces the load on the knee, okay? So we actually want to try and decrease how much force is going through that knee a little bit more. And then obviously, because the tendon is weak, the most important thing you can do for this is actually strengthen it. And how you're going to strengthen it and that sort of thing, it depends on the patient. It actually varies. You can't underdo it, you can't overdo it. If you underdo it, this tendon is not actually going to get strengthened. And every time you try to go back into running, it's going to give you problems. But then if you overdo it, you're actually going to start breaking down the tendon even more. So some things you want to do is you actually want to aim for a little bit of pain with your workouts and your runs, but not too much, okay? But typically this sort of thing usually takes about 12 weeks or so for it to get better, sometimes a little bit longer if it's a little bit more severe. Okay, so we're going to dive into the second part here. And again, as usual, if you have any particular questions or anything like that, put it in the Q&A part of it. If you have comments, feel free to just kind of share with each other in the chat. So we're going to start off with the second bit here. So it's called the Patellofemoral Pain Syndrome, PFPS. This is another one that's common, and some of you actually might have been diagnosed with this quite a bit. So this is very similar to tendinopathy, except the pain's actually on the kneecap or even kind of underneath the kneecap, okay? So you've got the kneecap here, and then typically patients will feel pain kind of either directly underneath the kneecap or a little bit more kind of to the outside or the inside of the kneecap. Sometimes it can feel dull. at rest, but then when you're running, it can actually give you like sharp twinges if it's a little bit severe. But it looks very much similar to the tendinopathy issue. So more pain in the beginning of the run when you're warming up, more pain with some foot strike, a little bit more pain going downhill rather than uphill. And then in severe cases, there can actually be some resting pain. Again, better with moving, worse with rest. Okay. Why does this happen? So the reason is a little bit different, okay? The reason why this happens is not actually because of what's going on in the knee, but rather what's going on in either the hip or the ankle, okay? What I want you to do is take a closer look at this particular person's knee, okay? So likely this person they've got some weakness around their hip, okay? If you look at this particular angle, it's going from here to here, versus in this particular diagram, the angle of the knee is going from here to here. And this can actually happen because if there is some weakness around the ankle, there's some weakness around the hip, it really differs from person to person. But, you know, the alignment there is not straight, right? So alignment can be a little bit off. Now, this kneecap, okay, so this area of the kneecap here and this area where it actually travels, it's a very smooth, very, very smooth surface, okay? But if the alignment is off, then you can actually have a little bit of grinding of some of that surfaces, okay? And it leads to some irritation, and it can actually lead to a little bit more grinding, a little bit more pain, okay? What to actually do for this? Again, avoid downhill trails, avoid narrow trails. You're gonna try a forefoot strike as well, okay? So kind of landing on the front of the foot, okay? But if this sounds like your symptoms, I want you to put it into the chat, okay? Type in PFPS, everybody, if you feel like these are the symptoms you're having. And again, the biggest thing is actually strengthening that knee, but also addressing the muscle imbalances, right? Because as I said before, it all depends on what's happening with that knee. Is it falling outside? Is it falling inside? Is it actually rotated a little bit? Different muscle imbalances can lead to different things for that. So again, it depends on the patient, right? Sometimes patients will come in with this particular diagnosis or this particular issue, and we'll see some weakness around the hip. Sometimes we might see some issues around the ankle. Sometimes what will happen is they might have say a hip surgery or an ankle sprain or something like that, and then they will develop this problem. So you really need to address some of those muscle imbalances. And again, which ones depends on the patient, okay? Typically, it can take maybe 8 to 12 weeks to address this, but again, a little bit longer. It all depends on the severity of what's happening with that knee. All right, third thing we're going to talk about, it's pretty common, okay? And my guess is a lot of members of the audience have had this. Personally, I've struggled with my IT band problems as well. And IT band problems, usually what patients will say is they've got some pain actually on the outside of the knee, right underneath this joint line here, like right in this area, okay? It can feel dull or achy, and it actually gets a little bit worse throughout the run. In very severe cases, you might actually feel it a little bit more going downhill as well. So if you've been diagnosed with IT band, if this sounds like the symptoms you're having, I want you to throw it into the chat, okay? I want you to throw an IT band into the chat if this is what you think is going on. Now, typically stuff you'll see when you're running, okay? More pain near the end of the run rather than the beginning, okay? More pain when you're going downhill. And especially if you like to run on trails, you might actually have a little bit more pain when you're on narrow trails, okay? And then in severe cases, if you actually do some cross training, you might have some pain with squats, biking, that sort of thing, okay? And again, in severe cases, you might have pain with walking as well. It all depends on how severe each case is and what exactly else is going on there. So the reason why this happens, now you might actually have heard before, there's a lot of misinformation out this on the internet, okay? You might have heard that it's actually because of the tightness of the band itself is tight. That's actually not true, okay? The IT band is actually it's like a very thick piece of plastic, okay? It's not like a muscle where you can actually stretch it or where you can actually shorten it or where you can like make it a little bit longer. It does not move. So it's not because of the tightness of the band. Rather, what happens is actually because of problems with the form. So if you actually look at this diagram here, this is actually a patient with an IT band problems, okay? And what's happening here is if you look at where they're landing, okay, if you look at the midline here, that's the green line versus where their foot is, you can see where it's crossing the midline here, okay? Typically with IT band, what we see is patients will have some weakness around the hips, or even just habitually, actually, they might land a little bit more to the inside. Sometimes habitually, they might have some, again, ankle problems, and they might be landing a little bit more to the inside. But what happens is when they land to the inside like that, the IT band here, there's actually a lot of pressure that gets generated right around the knee, okay? And then if you actually look at this diagram, this shows IT band. So part of IT band is like a Y-shaped band here, okay? And then right underneath in this area, there is a big piece of fat, okay? So the IT band puts a lot of pressure on that piece of fat, and then that actually gets irritated. That's why you have some pain there, okay? What that means in terms of management, though, yeah, as usually, you're going to avoid downhill trails and narrow trails. You might have heard some advice on stretching it and foam rolling it and things like that. Do not do that, okay? Because like I said before, it's not a muscle, it's a thick piece of plastic. You can't stretch it. And if you actually, there's already a lot of compression on this piece of fat here, okay? If you actually roll on it, or if you're going to foam roll that particular area or foam roll the IT band, you can put more pressure on it, and that can actually make things a little bit worse, okay? Rather, you actually want to correct the main problem, which is the form. So you want to make sure that you're running with your feet apart a little bit. If you have got any particular imbalances around the hip and things like that, you want to get those looked at. This is one of those things that can be very severe, or it can actually be pretty okay. So patients I've seen personally, I had IT band issues long before I knew anything about biology, and that actually put me out of commission for a whole summer. I wasn't actually able to run for a whole summer. Versus I've seen cases where they're ultra marathon runners, and these issues are only coming in after they ran like 30-40 kilometers. So it very much depends on the patient. It can take anywhere from like 6 weeks, 20 weeks, really depends on what how severe their symptoms are. Okay. All right. Next thing we're going to talk about, now I know this is not directly in the knees, but it's close enough, and this is a very common running injury. So we're going to chat about this for a second. For those of you who are experienced runners, you probably had your brush with shin splints, you've come out of it, and you've moved on with your running. But for those of you who are in the audience who are a little bit more inexperienced runners or want to get back into running, this is something you need to watch out for. So Shin Splints is also called Medial Tibial Stress Syndrome. Really what it is just pain around the shin, okay? Kind of outside in this outside part or on the meaty part of the shin. Normally what you'll find is there's more pain in the beginning of the run. So if it's not too severe, it might actually get a little bit better halfway, and then it can actually come back again a little bit later in the run. In severe cases, you might even have pain with walking, okay? But this is one of those things that's actually a little bit frustrating, because when you're not running, it actually feels pretty okay. So, patients sometimes get a little bit frustrated, and they'll kind of rear up their shin, and there's like, I can't feel a whole lot here, so I don't actually know what's going on, okay? So if this sounds like your issues, or if you actually had shin splints before, I want you to type in shin splints into the chat, okay? Just throw it into the chat for me. I'm going to walk you through why this happens. So really the main cause of it is just some imbalances. That's kind of the keyword of tonight, and inflexibility, okay? I'm going to ignore all the labels. I'm just going to give you kind of the Sparks Note version of this, okay? So you've got some tightness. Likely there is some tightness in the calf, and likely there's some weakness in some of the front muscles around the foot, okay? And what I want you to look at is if there is tightness in the calf, then front of the, so if there's the muscles that are at the back of the calf, and if they're a little bit tight, then you can kind of understand that the front muscles have to work a little bit harder. If the front muscles have to work a little bit harder, and if they actually do too much work, what happens is the front muscles are the blue ones here, okay? So that particular compartment, the entire compartment actually swells up a little bit, the entire compartment gets a little bit irritated, okay? And then that's what leads to that pain in that meaty part of the shin, and then afterwards it actually gets a little bit better when you're not running, okay? What to do for this? So unlike some of these other issues, you're actually going to avoid uphill trails. Okay, so you actually don't want to do anything that's going to make your foot even bend a little bit more. So correct term, scientific term is more dorsiflexion, but you want to avoid something that's actually going to bring your toes up towards you even a little bit more. Okay, you want to avoid narrow trails. And the most important thing is you do not want to take prolonged rest early on. What I mean by that is there's a lot of stuff online that will show you if you get shin splints, take it a little bit easy. Don't run for a couple of weeks. You don't want to do that. You still want to keep running, okay? But you actually want to continue focusing a little bit more on listening to your body a little bit, right? If you have a lot of pain, don't push too much. But if you have a little bit of pain, like a little bit to medium pain, it's okay to push a little bit. You want to try doing a midfoot strike, so kind of try landing on the middle of the foot. Landing in the middle of the foot, basically, long story short, is going to take off a little bit of load from those muscles, okay? And then correcting the form, addressing muscle imbalances as usual, so working a little bit more on stretching the calf and strengthening some of the front foot muscles, okay? All right. So those are kind of the four things that for pathologies we're going to talk about, but the take-home message is this, okay? You can do it. All running problems are treatable. Running is one of those things where you can do it at any age. There's no age restrictions. Sometimes, senior patients will come in and they'll say, oh, I'm so-and-so old. Can I actually run? I feel like I'm past my years. You can always run, okay? It's just a matter of starting off slow and kind of building up to it, okay? So if you don't remember anything from this workshop tonight, this is your take-home message, okay?